Well, everyone has a lot of questions about the coronavirus, the orders to stay at home. How prepared are we, and what exactly happens next? This afternoon, St. Louis Mayor Lyda Krewson joins us live to answer some of those questions that all of you might have. First, Mayor, we know you are working around the clock, and we truly appreciate you taking the time this afternoon to join us live.
Happy to visit with you, Claire.
Well, we are getting a lot of calls in our newsroom, a lot of us individually getting emails from people about tests saying that they're sick, but they cannot get tested. So first, does the city have enough tests? And if so, when can everyone who wants to be tested get tested?
We absolutely need more tests. I think you are hearing that from everyone that you interview about this. We do not have enough tests to test everyone. We do have enough tests through both the private sector, Quest and LabCorp, and our hospitals in order to test those who meet the criteria. But we know that we all need more tests. We need more swabs. We need more of the reagent to process the test. We need more personal protective equipment. We need all of that, and we really need more help from our federal government on that score.
When you say individuals who meet the criteria, what exactly are you talking about? What should people at home say, okay, I have this symptom, I have this symptom, I have this symptom, then I should be tested?
Well, if they have symptoms, you should absolutely call your medical professional. And if you can't get in touch or you don't have a medical professional, call our health department, which is 657-1499. But first thing, call your medical professional, go through the screening criteria to see if you need to be tested, and then get the test. It will likely take a few days to get the results of that test. But testing is very important, and I can't say it enough. We need more tests. I turn on the TV, every mayor, every governor, everyone who's working on this says we need more tests.
So how do we get more tests?
Tests have to come from our federal government. That's primarily how they are being distributed. And so it's critical. We are doing testing here. Here in St. Louis right now, we have 63 positive cases. We are waiting on test results of 26 people, and we're watching about another 150 people, monitoring 150 people. Our numbers are going up every single day. One of the things that I can tell you is that from the test results that we have right now, it's about half men, half women. It affects both races, all races. It is also, while it does skew a little bit older, the highest number of cases in the state of Missouri is those cases for people in their 20s. So this affects everyone, and we all have to stay at home, wash our hands, and this 6-foot distancing is really no joke. This is very, very serious. I know that many people, most people in fact, are following this stay-at-home guideline. We so appreciate that because it will make a difference over time, even though it's hard on people, and it's hard on businesses and hard on the people who aren't able to go to work.
We know you have testing sites in the city. We've heard from a number of people who live particularly in North St. Louis City. Where do those individuals go to get tested?
There are 2 testing sites in North St. Louis. One is Affinia, the other is Family Cares. Both of those are up and running, and so you still have to go through a medical screening process. Call your doctor, call your federally qualified health center so that you can be screened, and then if needed, you will get the test.
You mentioned it earlier as we were talking. We mentioned it earlier in our newscast just a few minutes ago. There's a lot of concern on the protective gear and the masks for the people on the front line. So let's talk about, particularly in the city, where do we stand on that kind of gear for our city's healthcare workers, and what specifically are you doing to make sure that we can get more here in the city?
Well, it's absolutely a concern for healthcare workers, and hospitals are working diligently on that. But in the city of St. Louis, we're also very concerned about our police officers, our EMS workers, our paramedics, our firefighters, even the people that are working in our water division and in our street department. Right now, this minute, we have enough PPE for our city employees, but we know that we are going through it at a much faster rate than usual. So we are constantly purchasing following through on other sources to purchase even more, because we want to make sure that those people that are keeping our city running, that are doing the essential services that we absolutely need, that those folks have the gear that they need.
As we keep our eyes on what is happening across the country, of course, a lot of people looking at New York. I mean, they have seen by far the most cases. In particular, their hospital systems really seem to be at the extreme right now. Here in St. Louis, are you concerned that our hospital system won't be able to handle the flow of patients we might see in the coming days and weeks?
Well, I'm concerned about that, and so are our hospitals. I was on a call this morning at 7:30 with the three major hospital systems, BJC, SSM, and Mercy, and they are doing modeling for the cases. They are sourcing personal protective equipment, and they are looking at beds and what beds are available. They, as you probably know, have already stopped all elective surgeries. We are not in a crisis situation at this minute, but we are very much planning, and they are very much planning for the need for beds 2 weeks, 3 weeks, 4 weeks down the road.
Can you talk about, we've seen outside of hospitals, we've seen some tents already being put up at some hospitals, but what about conference rooms? Are there other areas in the hospitals that they're perhaps putting these extra beds in what we could see an influx of patients?
Well, they're planning for all those things, both in the hospital facilities and outside of the facilities. That's all very fluid right now. You see how much this has changed just in 1 week. And so it's a very fluid situation. Our hospital systems and our public health systems, Dr. Fred Eccles is the city's public health doctor, and they are working together day in and day out to plan for this. But it's our job as city leaders and as residents and businesses of the city to stay home, to try to do the things that we can to flatten the curve, as we say, so that we don't hit that spike and not have enough medical facilities. I do want to just say thank you so much to the healthcare workers. I want to say thank you also to our city workers who are continuing to deliver essential services, police, fire, EMS, corrections, refuse, water department. All of those folks are doing a yeoman's job really right now, and we thank them. We thank the grocery store workers. Stay home as much as you can and keep your distance.
Yeah, all those individuals really, truly working around the clock now more than ever.
Yes.
Big city mayors across the country, they're putting out projections right now on the number of expected cases. What are your projections here in the city of St. Louis?
Well, our hospital systems and our public health department is projecting that our cases will go up double every couple of days. And it's been about 10 days since we had our first case, and we had one case. Today we have 63 cases. Yesterday we had 53 cases. So it is going up, and as we are able to get access to more tests, our numbers go up even more. So it's not just a focus on the number. I'm certain that we have people in our community who do have COVID-19 but have not had the test, and we don't know that. So this testing is really important, but so are the stay-at-home procedures, the wash your hands and stay your distance procedures. One of the things that I may not have said is that we know that in our city, there are cases in every zip code in our city, every zip code. So it's just one of these things that we all have to be really mindful of this. This is very, very serious business. So we so appreciate the publics and our businesses who are abiding by the stay-at-home order. And I think we have very high compliance on this. And I just want to say, I know it's hard, but I know we can count on the people of St. Louis.
Yeah, it's going to take everyone involved in this. And before we let you go this afternoon, the president saying he hopes things are beginning to normalize around Easter. That's a little more than 2 weeks from now, about 17 days. Do you share his opinion? And if not, when do you think things will be back to normal?
Well, of course I share his hope, but right now I don't see that in the information that's coming to me. I don't see that it's going to be just a couple of weeks before things are, quote, normal. I think we're going to have a new normal here. And I hope that he's correct, but that is not what we're seeing here in Missouri at this time.
And before we let you go, Mayor, I want to give you the opportunity to talk to the people of St. Louis. What do you want them to hear from you in this time? There's a lot of anxiety, there's a lot of worry, and we're looking for some hope from somebody. What do you want to say to the city of St. Louis?
I want to say to all of our residents and all of our businesses, thank you. We know the people of St. Louis always pull together. We will get through this together. These days, we're only on day 3 of this stay-at-home order. And I've been out talking to people in all of our city departments. We're running a skeleton crew, but I know that people are worried. So take the precautions that you need to take. I know St. Louisans, they're good people. They'll help us out here. So thank you.
All right. St. Louis Mayor Lyda Krewson, again, we truly appreciate your time this afternoon. Of course, we will be in touch with you again soon. Thank you for all of your hard work.